The months leading up to her birth had been very difficult because I was carrying a child that I didn't know if she would live. Early on in my pregnancy, I started to have some abnormal pain. So I went to see my doctor and they did an ultrasound. They wanted just to check to make sure everything was okay. And during that ultrasound, they found that our baby, Makayla, had a birth defect called an omphalocele, where the baby's abdominal wall doesn't form properly. So their organs are in a pouch on the outside of their body.
During one visit at our doctor in Ames, they said, hey, let's do an ultrasound, make sure everything's looking okay, so we know what steps to take next. That's when they found that there was an omphalocele. The plan was that they would take overall care for her. They'd send us to a specialist there. They'd do more in-depth testing. And that's when they found out that with the omphalocele, the club foot, the kidney issues, and the spina bifida, that they kind of consulted with the University of Iowa. And at that point, that's when they decided that it would be best if all care, prenatal care and after Makayla was born, would be taken over by Iowa City.
They got me to Iowa City right away, and at that point they were going to monitor her constantly and keep me on bed rest for 3 weeks. Once she was born, they realized also that she had more birth defects. They found that she had exstrophy of the bladder and bowel, which meant that her bladder was in 2 halves and also on the outside of her body, not in the pouch with her other organs, and her bowel was also on the outside of her body. They also found that she had several multiple organs as well. So the silver lining was that we had a diagnosis then. They were able to diagnose her with OEIS, and so then we at least knew what we were dealing with. OEIS is very rare, so the treatment for it is complicated. It's truly case by case. We had to come up with a plan of care with her physicians. All of her specialists had to work together. The University of Iowa Children's Hospital does a great job of having a team approach. It's been incredibly important for us because Makayla sees so many different specialists. At one point, she was seeing 14 different specialists, and to try to keep that many people all on one page, it is very important that they're all working together as a team. And when she's had 14 different surgeries, they've had to decide what order all of those surgeries needed to be done. With OEIS, it's truly a case-by-case scenario. There's no textbook example to follow on what order to do surgeries in, because from one child to the next, it can range on the severity of each birth defect.
It's a pretty scary moment when you know, first you're excited about the whole pregnancy right away, and then to find out that you don't know what the outcome's going to be. You know, you have a long road ahead, and it's going to be a lifetime journey to get through. But they had a good plan. They prepared us for everything that she's gone through. She can be in the hospital just out of major surgery, and that evening she's got a smile on her face. She knows she's in the hospital. She knows she's going to be here for a while. She just does an amazing job of putting things in perspective and just being happy.
To look at her today, it's just amazing. We didn't know if she'd ever walk. We didn't know if she'd ever live, and here she is today, and she's running, jumping, dancing, playing sports, and even learning how to do head spins and dance. So those are all things that we didn't know that were ever going to be possible. We, in our wildest dreams, couldn't have even hoped for.
If I could say anything to the doctors and nurses that have taken care of Makayla, it's just thank you for listening to us, taking care of our daughter, putting her needs above any of your own. You guys have been amazing to our entire family. And for that, we just thank you over and over again. There isn't enough thank yous in the world that can be said for what you have done for our family.